a new time today for YouTube because there was some problem. So on Saturday we could not take the YouTube live. Let us start a session, and if there are no questions still, we'll basically start with maybe a case that would help you in understanding a remedy differently. So it's a new time, I think, and people will take some time to join. Welcome, Dr. Pampala. Good evening. So there was a very interesting and normally what happens in this whenever there is change to from change of climate and the winter has started, so when the winter starts, the most common symptom that happens in children basically is that the nose become the stoppage of nose is the obstruction is there, and the patient comes to you and says that she's putting some drops. Until the drops work, she's better or he's better. After they stop putting the drops, again the obstruction in the nose, they cannot breathe in the night, and that starts. So this is a very common problem. Dr. Samira, Dr. Devesh, Dr. Vishal, welcome. So these are the very common problem basically we face in this type of conditions. So you have to remember few remedies which are very, very clearly indicated for the obstruction of nose, especially when the patient comes and says that the obstruction of nose was only one-sided. He comes and says sometimes the left side is problem, sometimes the right side is a problem. So it's a very, very common problem. Welcome, Dr. Meera, and welcome to a new time and a new day because of some untoward incidents, we could not do the live on Saturday, but next time it will be on Saturday only. Good afternoon. So let us again go and understand one-sided nose obstruction. Tell me something. What do you prescribe for one? Hello, Dr. Babel. So one-sided obstruction of nose, sometimes left, sometimes right, and it's always on one side. So which remedy comes to our mind? That is very important that I should know. That what do you all think or what do you all prescribe for these conditions where the obstruction is only one-sided? Anybody? So if you give me some answers, I'll basically not repeat the remedies. Anybody? One-sided obstruction of nose, very, very common, very, very interesting, because this will be a very common problem in everybody's OPD, Then we can differentiate that obstruction is more in the morning or more in the night, that it goes further. But one-sided obstruction, you must understand there are few remedies which are very, very common. Yes, Tucrium is one of the remedy. And especially when the patient comes and tells you that obstruction is more in the night. So those remedies are different. So whenever you have obstruction of ammonia, ammonium carb is a very interesting remedy. Yes. So both on Instagram and on YouTube, the answers are same. When my experience, one-sided obstruction of nose, normally think about Nux rhododendron, Staphysagrilla, sulfur. One of the very, very important, ammonium carb is a very, very interesting remedy. Lemna minor, yes, phosphorus, Salacia calcarea. But do add in your mater medica, Nux rhododendron, sulfur, and Staphysagrilla. Now when the patient comes and tells you, especially children, they come and tell you that my child has a problem in obstruction of the nose, especially in the night. And the most important remedy, as you all told, that is ammonium carb. Ammonium carb has a very, very interesting symptom whenever the obstruction is at night. In that, you have to think 3-4 remedies which are very, very common and have given me very good results in my practice. First, ammonium carb, Nux Lycopodium, Calcarea carb. Very, very important remedies, and few rare remedies which are again very important if the symptoms match. That is ferrum iode. Ferrum iode and calcarea iode also. Ferrum iode is again a very, very interesting remedy. If you read the mathematics of ferrum iode, you will be surprised to know that it contains a lot of symptoms of nose obstruction. In the same way, when the patient tells that the obstruction is in the morning and not in the night, then the gravity of prescribing ammonium carb or Nux is not so much. So at that time, in the morning, if the patient comes and tells you, do think about calcarea carb, carboanimalis, hiparsulf, calibichrome, phosphorus, silicia. These are very, very important remedies when the obstruction is more in the night. So this is how you have to differentiate the remedies, and then the time, morning at what time in the morning or night at what time in the night, and you will get fantastic results with single dose, and you will be able to avoid those drops which are put by a lot of patients as they come to you, and as it contains like Otroven is there, as it contains inflammatory medicines. So we suppress the inflammation, we suppress the sora, and that disease or symptom continues, and then it becomes very, very difficult to cure that complaint. So ask the symptom properly. These are the common medicines, morning, night, and you'll be able to give good results. Sometimes you know what happens, the patient comes and tells you, very, very important, understand this, obstruction of nose with discharge. Now, this is again a very, very important symptom and a very surprising symptom. I had patient where the patient says that obstruction of nose is there, but it alternates with discharge. Like sometimes the nose is obstructed, sometimes the nose has a lot of discharges. So, in these conditions, there are few remedies which are very, very common and which are very, very important. I have seen in my practice. The first is arsenic album. When the discharge is alternating with obstruction, think about arsenic, think about silicia, think about nitromur also. So this is how you have to differentiate obstruction of nose, because I've been seeing lot of patient when the change of season is there, the winter has set in, and that's why these remedies are very common, especially if you are asking me for children's. In children's, the remedies which are very, very common, think about Sambucus nigra, Nux vomica, arsenic, and Lycopodium. These are very, very common, and these have very, very important indication in obstruction of nose. Materia medica wise, go in your materia medica and read the symptoms, and you'll be able to treat those symptoms very, very perfectly, because the simulum will be very, very as required for the case. So welcome Dr. Firdausi, Dr. Angari. So one question, Dr. Yasin, medicine used in case of smog, itching throat, sore throat. See, I have told you in one remedy, I think last YouTube, that whenever the patient is aggravated by smoke, I have told you one remedy. So go in the last YouTube live and see. Smoke aggravates all the symptoms. Smoke aggravates the cough. The smoke aggravates the coryza. And I had told you some remedies. I have told you one rare remedies also, rare remedies. So if you have seen my last YouTube live, go to that and you'll get the answer in that. If you don't get the answer, I'm always there. So let's have some other question. Dr. Vishal, yeah, phosphorus is there. Good afternoon, sir. Nicely got good results using Hikla lava for wisdom tooth pain, severe pain. Very nice. And Dr. Chatterjee, thank you for sharing your experience so that we all can learn. Thank you so much. Doctor sir, please, anxiety with hand trembling along with anger. Yeah, Dr. Akila, very, very interesting symptom, very, very interesting symptom. And this is a very, very common thing, whenever the patient says that I have trembling, मतलब मेरे हाथ पैर बहुत कांपते हैं जब भी मुझे स्ट्रेस रहता है या टेंशन रहता है. If I don't know, I must have told you that trembling is a concomitant symptom of a very, very important and a very, very chronic remedy. Which is that remedy? Anybody can recall that? I had told you trembling is a very, very important concomitant symptom of a very, very important chronic remedy. Which is that remedy? Welcome, Dr. Chanthekar. Sorry if I am pronounced it wrong. So, can we have some remedies? I had told you one remedy, that whenever there is trembling in all complaints, concomitant symptom, think about that remedy. The remedy is calcarea phos. So a very interesting question. Whenever there's anxiety, for example, going for an interview, appearing for an exams, going to see a girl or going to see a boy, going in the clinic, or whenever there's a lot of anxiety and there is trembling, 3-4 remedies, very, very common, Dr. Akil. Arsenic, calcarea carb, chamomilla, lachesis, pulsatilla, rustox. Very, very important remedies, and these remedies have given me so many good results, especially arsenic, especially calcarea, especially coffea, pulsatilla. Very, very interesting remedies whenever there is trembling with anxiety. Of course, there are a long list of remedies, Dr. Akil, but these are the main remedies for which I have got very good results. Sir, in low TS level of FSH, that is follicular stimulating hormone, till how many days we can give folliculum? No, see, folliculum basically, if I use folliculum, I'll basically give folliculum weekly for at least 2 or 3 weeks. That's all. I'll not repeat too much folliculum. But it is not a specific, that follicular stimulating hormone, give folliculum and it will give results. If there is low FSH, it is basically a problem of the constitution. So miasmatic prescription is very important. And if after prescription you feel that the remedy has stopped working, or the remedy is not showing improvement as you expected, then you must give follicular as an intercurrent. That would give you good results. In these cold days, nowadays, we see flakes and flakes in nose, and patients with the remedy should be practiced. Yeah. So, see, I have told you before also in my, I think, last YouTube live, it's been about 3 years that I'm taking YouTube live now. I had told you, I don't know, if the patient comes with a lot of cracks in the nostrils, So whenever there's a lot of cracks in the nostril, there are few remedies which are very, very important. Second, there are conditions where there is a lot of crust formation, like scabs, and the patient digs in the nose and takes out those scabs. So there are two different conditions. Whenever you feel the nostrils is cracked, remember the remedy, very, very important: antium crude, petroleum, graphitis, or a metallic. When there's cracks in the nostrils. The second question we get common, there is scabs, scabs inside the nostrils. In this condition, whatever remedy comes to our mind, very, very important remedies: Bovista, Chamomilla. Again, I think graphitis can be given, Thuja, Calibicrome. So these are very, very important remedies for cracks in the nostrils and scab formation in the nostrils. These are very, very important. Hello, Dr. Vibhuti. But sir, now patient says that there are some pain in specific in night. Can I continue with Hikla Lava or some other medicine negative? See, if all the symptoms after giving the medicines are coming down and the patient is improving, so don't change the remedy immediately. First go with high potency. If there are appearance of new symptoms, then you have to think about changing the remedy. So if it is giving results, some symptoms may go early, some symptoms may go late. So don't immediately change. Think of something, going to high potency. And if the symptoms altogether change, then you have to refer to Kent's 12 observation, and according to that, you have to change your prescription. Welcome, Dr. Komal. So please share experience about tennis elbow. Yeah, see, if you basically just try to know that what is tennis elbow. See, tennis elbow, don't prescribe on this tennis elbow. For example, diagnosis. What are the symptoms? That is important. So if you feel that the patient complains of pain, pain in the region of elbow, or the patient complains about burning, or the patient complains about migrating pain, in these conditions, there are basic remedies, what we think about, the same remedies which basically come in our prescription. Like you must start thinking, for example, simple remedies like Rustox also would help you, because we are taking symptomatically, so Rustox may help. In some condition, there are remedies like causticum, Cilicia, Lycopodium, Calibicrome, causticum. These are the remedies which have variety of symptoms. So don't treat as disease like tennis elbow, rather than take a lot of symptoms from the patient and then prescribe, so that you'll be able to heal it faster and better. Dr. Harshal, welcome. Sir, kindly arrange a lecture on constitutional medicines finding in patients. Yeah, see, what is constitutional medicine? Whenever you take a wonderful case, it's a beautiful case taking you try to analyze the case, then you miasmatic evaluate the case, and then repetize it. Then in repertory chat, 3-4 remedy comes. Then depending on the knowledge of mathematics, depending upon your understanding of the case, you prescribe the medicine. So whenever I've taken Google limit, as before, whenever I've showed you some cases of cure, we have gone in the same way, like taking the case, repetizing the case, and then getting to the remedy. So it's like this. Dr. Pratibha, welcome. Dr. Sharon, welcome. So this is how you have to understand constitutional prescription. One question, sir. Pruritus vagina within general yellow stringy leukorrhea, sometimes bloody stringy leukorrhea with offensiveness with itching, suggest something, a remedy. Sit. Dr. Ashwin, Dr. Ashfia. See, whenever the patient complains about leukorrhea and pruritus vagina. Now see, pruritus vagina is, you see, it's very easy to understand, tell you the remedies, but pruritus, I remember few cases in my practice also which I had difficulty in treating, but in pruritus, make sure that the patient is not suffering from a primary disease like The patient is suffering from hypothyroidism, hyperthyroidism, or diabetes. In this condition, what happens because of this, the itching increases more and more. See, there are lots and lots of remedy. I remember a case where the patient came and told me that the itching was so much that she felt that she could tear or take the skin out of the itching. It was so severe. And if you see in Matra Medica, there's one remedy which is very very interesting, and the remedy is Helonius, Helonius diadana. The patient has so much itching, so much severe itching that the patient feels as if to tear the skin of the vaginal area. So make sure that the primary disease, if the patient is suffering from, is taken care of. Otherwise, there are a few remedies which are very very important. Please write down. Helonius is first, creosote, nitric acid, caladium, and sepia. These 4 5 remedies, of course, there are lots of remedies depending on the symptomatology. But whatever symptoms you have written, these remedies come very close to that. So write down these remedies and you will get definitely good results. And as people share that their results, you can also share, and then we can learn from that. Pratibha Kapre, I other sent a request to be in your video live. Yeah, okay. So there was injury in knee by falling or no relief with arnica, ruta, and rustox and pain all in how to approach. See, the problem starts. See, the problem. No, I have not told elapsed, Dr. Akil. So, Dr. Amulya. See, the problem starts where whenever injury comes, and then we start thinking of remedies, all injury remedies, like you have seen arnica is there, ruta is there, rustox is there. But there are remedies which are so important, and sometimes what happens, we forget those remedies because it has normally not crossed our mind very frequently, because most of the cases conium, arnica and all work very well. Now if you have seen conium maculatum, it's a very very interesting remedy for injury. And now if you see in conium maculatum, it is written, it's a very very important remedy for injury. If you have Allen's keynote, you can see that it's a remedy for injury. Old injuries which are not healing, conium responds very well. And either it is basically related to glands or related to bones also. Conium is again a very important remedy. So think about conium, a very interesting remedy. Of course, you must have given all the other remedies, and still if you find that the result is not coming, then you have to go for the case taking, because the miasm involved is there that is hampering the cure. In that case, you have to think about a miasmatic remedy. So think about the injury remedies. If you go to see the Fatak remedy, there's a remedy, injury, sore, and bruise, and there are about 20 to 30 medicines. So it is very important to understand that if ruta, Belispar, rustox, guaiacum, arnica, this does not work, then go for the symptomatology and take the case before prescribing the routine remedies. See conium in Allen's keynote. It is very well written. Elapse, I did not say, Dr. Akhil. In fact, in conium, I remember a case where the patient had, the lady had fallen on the ground, and there was a lot of injury and pain in the chest, and after some time there was a nodule formation in the breast which was very very hard, and a lot of other remedies, like I also prescribed arnica, did not work, and then conium I prescribed and it gave me a very good results. So if you see in conium Matra Medica is written that glandular induration, stony hardness, so that is also important to understand which Matra Medica are you using and how you are applying that symptom in your patient. Yeah, can we go further? See, if I could go further, Dr. Amulya, add few remedies for injury. Arnica is there, conium is there, rustox is there, pulsatilla and lacasis is also very important if you have seen the Matra Medica. And one remedy you should remember very rare, strontium carp is also there. Patient having finger pain and said that her finger pricked by fish bone 2 or 3 days early. See, then see, it is pricked by fish or anything is okay, important. But see, it is basically injury by a sharp cutting instrument. That is important. So in Mathematical, go with that. Lead and pile is there, staff is there. It's a sharp cutting instrument. So go with that, and you will get the uh, results. So should we consider miasm in acute cases, because many times polycrest head are head. No, miasm will come every day in your practice. Miasm is basically a way of life. Everybody has that miasm in it, and whenever there is that's miasmatic influence, the body throws out symptoms. Apart from indisposition, if you have eaten too many ice creams and all, and you get symptom, that's indisposition. But miasms you have to consider every time. As I've always told, unless you give a similimum, the body will keep throwing symptoms, and it's very important to give a similimum so that you cure that cases. One symptom also I would like to add, Dr. Mulya. There are symptom where it is written that constitutional effects of injury. Constitutional effects means injury to the knee is there, but the whole patient is responding. The whole patient has some symptoms. In that case, also ledum pal, natrum sulf, arnica, and strontium comes are given. So that's also it just crossed my mind. That's why I'm telling you. Dr. Snehal, welcome. Dr. Indranil, I hope you got the answer. So, Dr. Mulya, I hope you prescribe the remedies on what I told you. Constitutional effects of injury. That is also important. Sometimes the patient comes and tells you that I had an accident and the bones are healed. But since that accident, I'm not feeling healthy. I have depression, I have XYZ. So, this is called as constitutional effects after injury. And in that case, also, you have to understand arnica is there, ledum pal is there, natrum sulf is there, strontium is there, lac acid is there. So, this is important to understand what injury has affected the patient, and the whole constitution is responding or the local part is involving. That's important. Okay, so let us go further. Few questions have scrolled up. You can always ask, write down the questions. I hope you are understanding what I want to tell, because every time we have very good viewers, good listeners, people keep listening. I hope you get some inputs in your practice, and you add to your knowledge, add to your practice, so that it will make me feel nice also that I have done something for the pathy. So if you are understanding and enjoying, do tell me yes, so that I can improve on my. If you are not understanding and enjoying, then I can have to change the way I speak. So please share your experience also sometimes. Sir, amenorrhea case of PCOD case seems sepia but not responding to sepia, pulsatile, natrum, kalicara. Any other medicine which should be we do in those type of cases? See, a case of amenorrhea because of PCOD. No, see, it is PCOS, polycystic ovarian syndrome. In that case, understand that the whole constitution has been taken care of. Whole constitution has been taken care of. Of course, if you feel sepia, pulsatile, natrum have not been helpful, that means something is lacking in your case. Do ask the patient something more what you have not asked. For instance, non-verbal communication. This becomes also important, Dr. Mulya. Like see the hair, see the eyes, see the nose, because you're not getting the case in spite of trying 4 or 5 medicine consultations. So non-verbal communication, way of eating, way of sleeping, way of walking, way of talking, that also is very important. Sometimes non-verbal communication will give you also good remedies. Okay. So Dr. Meera is very happy. Dr. Amula is happy. Dr. Indian, only 4 doctors are happy with the YouTube. I hope everybody gains something. So one question from fractured coccyx during birth. Oh my god. So whenever you have conium hard knotty on upper disappeared after conium. Yeah, fantastic. So thanks for sharing your remedy also, Dr. Weber, and your cure also. So hard knots on upper arm disappeared after conium directly. Very nice. So good learning experience for everybody. So see, hard knots automatically see the symptom of hard knots. It is written in a Mathematica, and it has given good results. So thank you for sharing your experience, and we all learn from this. As you go further, it has written coccyx, fractured coccyx. See, coccynoderma is again a very, very irritable. It's such important that the patient should basically go for exercise. But whenever a fracture of coccyx comes, the most important thing which I tell to my practice, rest. Rest is very, very important. And then we have the so-called very, what do you call, specific remedies, like we have hypericum, we have uh, sulfur, we have mercury, we have causticum, we have silicia, we have lots of remedies. But till date, I have not got a case of coccyx fracture. I have told you the remedies, but I have not got the case of coccyx fracture, so I can't comment on that. Winter aggression coryza loquacious period symptom with nose block. Yeah, very interesting case, Dr. Karpe. And see, aggravation winter is basically in coryza, could be taken as a normal symptom, loquacious patient. So go see locacity is itself. Don't always think about what we think about for locacity. Anybody? Whenever the word locacity comes, we just grab one remedy very quickly. And what is that remedy? Anybody? Locacity. Yeah, tophi also basically is the result of disease, so that's basically what we call the end result of miasms or end result of disease. So then depending on the tophi, otherwise, everybody will give that conium in case of what you call rheumatic or gouty conditions. Yes, lachesis we have most of us think about lachesis, but see, locacity has lots of other remedies. Lachesis is of course one of the most important remedies, but do think about hyoscyamus, lachesis, stramonium, moscus. In fact, one remedy I told you in when I was taking a YouTube live, that's a very interesting remedy. And I have told you that we hardly think about that remedy when the patient talks uninterruptedly. What is that remedy? Anybody? I told you the remedy. The patient talks uninterruptedly. Anybody? Yes? The patient talks uninterruptedly, and Dr. Babal has given a very beautiful, that is lachesis. Oh, sorry, phosphorus. Phosphorus do consider in locacity. Of course, there are lots and lots many of remedies, but do think about lachesis, stramonium, hyoscyamus, moscus, phosphorus. Very important remedies, for locacity. And in your case, when the coryza is there, of course, phosphorus becomes very important. In fact, heparin sulf is also there. Heparin sulf is also there for locacity. In fact, Crotalus cascavel is also there, and Kali iode is also there. So these are remedies which have locacity and that symptom of coryza. Yes, Dr. Babel, phosphorus for there, and you got it right. Phosphorus has different shades, So whenever I am reading mathematical, try to get the different shades of remedy. Yes, so for locacity, we have lots of remedies. First remedy, everybody was very quick in answering lachesis, and I'm very happy that at least that part of maternity, everybody knows it. See, in lachesis, locacity, the lachesis patient becomes loquacious when excited also. If you excite somebody, keeps on talking. So lachesis is there, cuprum metallicum is there, theridion is there. They talk, they are so loquacious when they're excited. That's the importance of lachesis locacity. Yes, so can we go further? It's already 3:30, but I'll still take some question. Interesting questions today. I also learned so much today, whenever I'm speaking, whatever knowledge of mathematics I have, I also share it. So I also feel happy that beautiful questions, and I also sometimes think to answer, but it's interesting, to have a two-way chat. Can we go further? All questions answered, or no questions till now? Dr. Gunarkar Samba, welcome. A few questions more before we close the session. Dr. Amulya, sir, what is the approach in cramps in legs in arthritis? See, what happens whenever there's cramps in legs in arthritis. Sometimes, if you have read arthritis and the systemic features, cramps can be taken as normal symptoms also. So, but there are remedies where the cramps are so severe, so severe that it becomes like stony hardness. So, if you want to have just prescribe acute remedies and you want just to relieve that acute symptom, you can think about remedies like magnesium, magphos, or calcarea fluor, sometimes lachesis, cuprum metallicum. But I would say that in case of arthritis, if it's a common systemic feature, think of something more rather than just prescribing on for those local symptom. Ranjana Maurya, welcome. Yeah, so I think it's 3:30 and I hope everybody's enjoyed the session. So we close for today, but we meet this week only on Saturday for our next session of YouTube Live. So thank you everybody. Muscular rheumatism psoriasis together. I'll answer on the next YouTube. Dr. Indranil, do have this question again because I have to give a seminar, go somewhere. So I'm getting late. Thank you so much. Thank you so much for your time.